This conference will now be recorded.
Ethan, to you.
Thank you. On behalf of the Department of Consumer and Business Services, Division of Financial Regulation, my name is Ethan Baldwin, and I welcome you to this public hearing to discuss the Division's preliminary rate decisions for 2022 health benefit plans. The Division holds hearings on all individual and small group rate filings. Each hearing is generally limited to discussion of the Division's preliminary decision and final objections regarding the filing. During this time, carriers will be permitted to defend their assumptions using information submitted in the filing or indicate agreement with the findings. Carriers may not introduce new information or propose new or revised assumptions at this time. When reviewing a rate request, Division actuaries consider such factors as recent and projected medical care and prescription drug costs, including any benefit changes, past and future loss ratios, that is how much of every premium dollar goes to pay healthcare claims costs. This is to ensure the requested rate is not projected to trigger federal rebates or payments from other federal programs. Division actuaries also review the recent history of rate changes and the overall financial strength, including profitability, investment income, and surplus of the company, as well as administrative costs. Division staff also ensure the filings meet all requirements of the Affordable Care Act and determine whether or not the anticipated number of enrollees will adversely affect an insurer's financial position. You can review the full rate request for all the companies on our website, www.oregonhealthrates.org. All communication for every health insurance rate change filing, including written answers to all questions asked during the review period, are posted there as well. In this morning's hearing, we will be discussing in this order the preliminary rate decisions the Division has made on individual and small group health benefit plans filed by BridgeSpan Health Company, Regence, BlueCross, BlueShield of Oregon, and Samaritan Health Plans, Inc. Our agenda for the hearing will be representatives from each company making a presentation and describing their rate requests. Then Division staff will lead a discussion about the Division's preliminary decision on each filing. Finally, we will accept public testimony. If you'd like to make a comment on the company's filing, please unmute, introduce yourself, and make your comment. Comments will be accepted online through 11:59 p.m. on July 7th. The Division will make a final decision about these filings shortly after the public comment period ends on July 7th. BridgeSpan, please begin by introducing yourself and explaining your rate request.
Good morning. My name is Dan Bader, and I am an actuary employed by Cambia Health Solutions, the parent company of BridgeSpan Health. I am joined by two of my actuarial colleagues, Lisa Mudgett and Lewis Nichols, and today we will be presenting the 2022 rate filing information for BridgeSpan's individual ACA compliant plans. Next slide. The requested annual rate change is 4.8%, and the main drivers of this are increases to the cost of medical care and utilization. Note that this filing's 2022 rate changes do not include adjustments for COVID-19 or the related economic impacts. Next slide. For 2022, BridgeSpan has consolidated its providers into a single network called Real Value. This results in the discontinuation of our 2021 accountable health networks with Legacy and OHSU. Our service area and covered benefits remain unchanged, and while formulary changes for 2022 have not yet been finalized, the filed rates assume no changes. Next slide. At BridgeSpan, we strive to help control escalating drug costs. With that said, prescription drug costs continue to rise, and we anticipate the costs to increase by approximately 4% in 2022. This results in an impact of tier rates of approximately 1%. And next slide. Yeah. And thank you for your time, and you can connect with us on our various social media platforms or our website at bridgespanhealth.com.
Thank you. Division staff will now lead a discussion about the Division's review of the filing and preliminary decisions.
Hello, my name is Tim Hinkle. I am the primary reviewer on this filing.
I'll go next. My name is Natasha Sizemore. I'm the Life and Health Program Manager. My team includes the actuaries and the forms review staff.
This is Drew Bucks. I was the secondary reviewer for this filing.
So when the division gets these rate filings, we begin our review, and we typically look at three things. And the first thing is the data. We ensure that the data is valid and it's from a good source and a reasonable source. The next thing that we look at is the calculations inside of the rate filing to make the projections, and we verify that those are appropriate and accurate. And then finally, there's assumptions used to make adjustments, and that typically is the bulk of our reviews of the assumptions, because those make impacts to some of the things that have some uncertainty surrounding them, and we review those assumptions for reasonableness. In fact, a lot of the times we compare these assumptions among all the carriers in the market to see kind of what range is the other carriers are looking at, and we compare those for reasonableness. In particular, in this rate filing, especially for the year 2022, the data was sourced from 2020 data for the majority of these rate filings. And as we know, 2020 was an atypical year, in particular because consumers were choosing to delay going to the doctor or for minor elective things, and therefore the claims that we would normally see were a little bit suppressed. And so one of the adjustments that we looked at in all the rate filings is what we're calling kind of a COVID rebound factor, and there was a wide range on these factors, but typically it was I think no more than about 7%. So what I mean by that is that the adjustment to the 2020 data was increased by no more than about 7% to account for the delayed treatment that occurred in 2020. It's important to note, a lot of the carriers did this in a similar way, how they came up with that adjustment, and the majority of the carriers looked at the 2019 data, because 2019 was pre-COVID, and the 2020 was where you had some suppressed months there. And so a lot of the carriers would take the 2019 data, make some adjustments, and trend it forward to 2020, and compare that with the actual 2020, and come up with some selection factors and determine what maybe that rebound might look like. In the case of BridgeSpan, I believe it was about a 6% rebound. We found that to be reasonable, and so we proposed no adjustments to this. The second item that we look at is trend, and as Daniel spoke about, this is just your medical inflation. So the increase in cost and utilization of services. Again, we compared this against other carriers, and we found that this, in particular for BridgeSpan, this was reasonable, and proposed no adjustments for this. And then the final two pieces that are really kind of interesting here in the 2022 rate filing season are the risk adjustment and the reinsurance. And it's important to note that the reinsurance only applies to the individual market, and I believe we have about $108 million for the reinsurance program, and we fully intend to spend all of that money in the 2022 calendar benefit year. So what we did is we compiled all the rate filings together and looked at what the projected reinsurance receipts were, and determined that that was, basically right on the money. I mean, it was about like $106 million. So no adjustments there. And finally, we did take a look at risk adjustment, and risk adjustment is kind of interesting here because the timing of when the actual 2020 risk adjustment numbers come out and the timing of, kind of when our preliminary decisions happen don't coincide very well. And this has just kind of been a recurring theme over the years. However, we did take a quick look at the actuals that came out from CMS about a week ago. And, in the case of BridgeSpan, we didn't see any major, anything that might indicate, any major differences. However, we haven't had enough time to look through all of it. That was just initially just looking through it. So I guess I would turn the question back to BridgeSpan. Have you had a chance to look through the 2020 risk adjustment numbers, and if so, do you anticipate any changes to your rate filing because of the final numbers?
We have had a chance to look at the final risk adjustment results. I mean, we're still in the process of evaluating those impacts, but I don't expect there to be a change. But like I said, it's at this time we're still evaluating.
Yeah, certainly, and we can most definitely follow up with an objection, and that might be the best course of action, just as an objection to see if perhaps there's any changes you suspect might be needed. In any event, we've proposed to approve the rate filing as filed. So I don't believe I have anything else here on the BridgeSpan filing. Were there any other questions from BridgeSpan?
Nothing from us.
Thank you. The division will consider this information in making a final decision on this filing. We will now accept any public testimony. If there's anyone who would like to testify, please unmute and introduce yourself. All right, hearing none, I'll remind anyone listening that July 7th is the last day for public comments, and they can be submitted through our website, www.oregonhealthrates.org. Next, we will hear from Regence, so we will pause briefly. All right, Regence, please begin by introducing yourself and explaining your rate request.
Good morning. Thanks for inviting us to speak today. I'm Lisa Mudgett, and I'm joined today by Dan Bader and Lewis Nichols. The three of us are actuaries at Regence BlueCross BlueShield of Oregon, and we appreciate the opportunity to share details about our 2022 individual and small group ACA compliant rate filings. Next slide. Regence has a long history serving Oregon. Over the past 80 years, we've served our community through nonprofit health insurance coverage and member-focused service. We serve nearly 1 million Oregonians and have offices across the state. Oregon is our home, and we remain committed to serving the community for the long term. Next slide. Overall, for 2022, our average annual rate change renewal request for our individual portfolio is 4.9%. For small group, our rate change renewal request is 3.8% with proposed quarterly increases. The cost of medical care and increased utilization are the main drivers of our requested rate changes. For 2022, we considered the impacts of COVID-19, but our rates do not reflect adjustments for COVID-19 or any related economic impacts. With our members first in mind, we strive to offer the most value for their premium dollars. Now we'll hand it over to Dan Bader to provide more detailed look at our individual plans for 2022.
Thanks, Lisa. And as she mentioned, I'll be discussing the changes for 2022 for Regence's individual ACA compliant plans. For 2022, in addition to our individual and family network, Regence is continuing to offer a broad portfolio with Legacy and OHSU. Note that while many of our OHSU plans are being discontinued in 2022, these plans are being replaced with other OHSU options designed to improve the member experience. Our service area and covered benefits remain unchanged, and while formulary changes for 2022 have not yet been finalized, the filed rates assume no changes. And I will now pass it over to Lewis to discuss the changes for small group for 2022.
Okay, thanks, Dan. Thank you, Lisa. Again, my name is Lewis Nichols, and I'll be speaking to the 2022 Regence small group plan changes. So for the small group line of business, there are no discontinued plans or changes in covered benefits for 2022. The service area is unchanged, and there are no proposed changes in provider networks. Regence is building a new digital platform to improve the member healthcare experience, and drug formulary changes are not finalized at this time, and pricing did not include any adjustments for anticipated changes. Next slide. For the impact of prescription drug costs on rates, Regence does work to hold the line on rising drug costs, and there are a few examples here. However, prescription drug costs do continue to rise, and we expect the increase will be about 4% for 2022, and that results in a premium impact of about 1%. And next slide. Here are a few ways you can connect with us. And thank you.
Thank you. Division staff will now lead a discussion about the division's review of the filings and preliminary decisions.
Good morning. Hello again. This is Tim Hinkle. I was the primary reviewer on these filings.
Hi, this is Natasha Sizemore. I'm the Life and Health Program Manager.
Was that it for introductions? I think we're good now. So when we review these filings, and I'll go through this a little bit quicker this time since we already went through the info on the BridgeSpan one. But when we review these filings, we typically look at three things. We look at the data to make sure that it's it's valid, and the source is reasonable. We look at the calculations used to project into 2022 and make sure that those are accurate and appropriate. Finally, we look at the assumptions, any of the the adjustments made to the data or into the projected period for reasonableness, and also we compare carriers among each other within the market. And in the case of Regence, I suppose well, it's important to note that we're proposing to approve both the individual and the small group as filed. So I suspect I can kind of go through each one of these items together just to speed it up a bit. We looked at the adjustments to the data in 2020, and for what we're calling the COVID rebound factor to account for the delayed services that the members, they delayed their services, because of COVID. In the case of the individual and small group, the factors were different, but again, they were within a reasonable range, and we proposed no adjustments to those. Trend was another item that we looked at. The trend that is used to project medical inflation and utilization into 2022. Again, we compared that among other carriers, and we found that to be reasonable and proposed no changes to that. On the individual side, again, the reinsurance was when we added up all the projected amounts from all the carriers, it was pretty impressive that it came out perfect. It was just exactly what we wanted to see, and so no adjustments. We're proposing no adjustments to that. And then finally, there's the risk adjustment, and this is for both the individual and small group. We haven't had enough time to look at these factors. I would like to ask Regence if you've had time to look at the factors, and if so, if you anticipate any changes to the filing.
At this point, our initial review came in pretty close, the final results versus our prior estimate, but we would like to spend a little bit more time with it to determine if we do feel a rate change, a change to our rates are necessary.
Certainly, we can follow up through an objection.
That sounds great.
Yeah, okay. And I believe that covers everything. Like I said, we're proposing to approve both of the individual and small group, both of these filings as filed. Does Regence have any further questions for the division?
None from us, thank you.
Yeah, thank you.
Great, thank you. We will now take any public testimony. Please unmute and introduce yourselves. All right, hearing none, I'll remind everyone listening that July 7th is the last day for public comments, and they can be submitted through our website, www.oregonhealthrates.org. Next, we will hear from Samaritan. We will pause briefly.
And this is Steve. I need to know who I should make presenter.
Hi, this is Trent Began, but I don't have anything to present on the slides.
All right, well, Samaritan, please begin by introducing yourself and explaining your rate request.
Yeah, certainly. This is Trent Began, Director of Finance with Samaritan Health Plans. With me is our Senior Actuary, Kelly Grubinski, and our Director of Product Development and Sales, Bridget Quest. We are here to present our small group rate filing for the calendar year 2022. We will continue to offer our EPO Platinum, Gold, Silver, and Bronze plans in 2022. These are tailored to our 3 counties, Lynn, Benton, and Layton counties. The rating results for 2022 are an average rate increase of 2.4%. The rate changes to our members are going to range from a minimum of 1.7% to a maximum of 3.1%. Quarterly increases were based on an annual trend of 5.4%, which correspond to 1.3%, 3.2% increase per quarter. Samaritan Health Plans currently covers 524 small group members across 15 different benefit plans. Our expectation is that won't change materially in 2022, and the plans will be pretty holding steady. We made some minor changes to the plan designs in 2022, more around deductibles and out-of-pocket levels, to make sure we met some level tiering requirements. But basically, we're going to continue to offer the same 15 plans in the EPO network that we did last year in our rating areas 2 and 5. As compared to the 21 filing, the only factor changes were made to the trend factor, and those were based on a recent Samaritan Health Plan experience and revised expectations for 2022, taking into account COVID-19 impacts. We also made some plan adjustment factors to account for some effects of healthcare trend and plan design changes. With that, I would say that Samaritan Health Plans really appreciates the opportunity to serve our small businesses in our region. We're all about the health and community health growth of our region. We appreciate the preliminary approval of our small group plans for 2022. And I'll take any questions now.
Thank you. Division staff will now lead a discussion about the division's review of the filing and preliminary decision.
Hi, good morning. This is Tim Hinkle. I am the primary reviewer on the Samaritan rate filing.
Hi, this is Natasha Sizemore. I'm the Life and Health Program Manager for the division.
When the division gets these filings in, we typically review the filings for 3 things. We look at the data, the calculations, and the assumptions. The data, we just make sure that it's from a reasonable source and it's valid data. The calculations, we make sure that they're accurate and they're appropriate and they make sense. And similarly with the assumptions, we make sure that they're reasonable. And all three of those things combined are used to project the rates into the benefit year for 2022. In this rate filing, Samaritan, they don't use the small group experience. They use a self-insured hospital experience, and therefore several adjustments are needed to bring it back down to a commercial small group level. We reviewed all those adjustments, and we found all those to be reasonable. There were a couple other adjustments within the filing to account for the continued impact of COVID in the future, and we asked for some justification on those, and we found the response to be reasonable. So we proposed to make no adjustments to that in the rate filing. The trend, the medical inflation utilization, again, we compared that against all the other small group filings, and found that to be within a reasonable range, and proposed no adjustments to that. With the risk adjustment, this one's a little bit interesting here in the case of Samaritan, because they don't use their small group experience as their starting point. They instead project to a market average by making adjustments to their self-insured business in order to project no risk adjustment transfers whatsoever, which actually makes our job a little bit easier for reviewing that. And so again, we proposed no adjustments there. And just to do my due diligence, I will mention that the final risk adjustment numbers came out, and of course, since Samaritan doesn't use its small group experience for this rate filing, I don't know if it's particularly helpful to the company or not to see the actuals, but I'll ask anyways. Have you looked at the final risk adjustment numbers? And if so, have you noticed anything that might indicate any changes to the filing?
I'll go ahead and answer that and let Kelly input anything else that he might want to add. But yeah, I've reviewed them, and given our small credibility and our population, it's really hard to factor those in the rates because yeah, we were actually very negatively impacted last year for 2020 experience. But the year before that, we were positively, and so it does bounce around the mean a little bit. So again, it's with our population, it's very difficult to factor those into rates. So we use that approach of using a market estimate.
I think Trent covered it. This is Kelly Grubinski. I have nothing to add.
Okay. All right. Thanks. So with having said that, we probably will just follow up. We'll just do a market-wide follow-up objection on the risk adjustment. So the division is proposing to approve the rates as modified, and the modification is actually very, very, very minor, and it's simply because in response to an objection response, or in response to one of our objections regarding, I believe it was the insulin bill 2623, the company made just some minor changes, very, very minor, to some of the benefits and some of the plans. So technically, we have to call that as a modification. So we're proposing to approve it, the rates as modified, but they're very, very. I mean, it's the modifications are very small. Does the company have any questions for the division?
No, thank you.
Thank you.
Great. We will now take any public testimony. Please unmute and introduce yourself. All right, it seems no one has signed up to testify, so let me remind anyone listening that July 7th is the last day for public comments. They can be submitted through our website, www.oregonhealthrates.org. Thank you, and that concludes today's hearing.